Thank you. Senator Luján.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to ask unanimous consent to submit into the record a CBO report from July 2025 on HR 1. Unanimous consent to submit that report. Appreciate that. Mr. Kennedy, that report found that there was a $990 billion cut to Medicaid, CBO report. That's not my question.
How can there be a cut?
Well, Mr. Secretary, it's in the record. I'd be happy to share it with you. Your team has it as well, CBO report.
It's a cut from the growth rate. Only in Washington is that considered a cut.
There you go, Mr. Secretary. In the same way that gas prices are not high today.
It doubled in the last 4 years.
Mr. Secretary, let's talk about vaccines. You've been asked quite a few questions today about vaccines. Your hearings this last week in the House as well, you've been asked a lot of questions about vaccines. You've been responding quite a bit about vaccines. I went back to look at statements you've made, I don't know, over the last 10 years or so on vaccines as well. I appreciate that you say today that you support people getting vaccine. Is that accurate?
Yes.
I was reminded, though, that July 6, 2023, Samoa 2019, August 2018, February 23rd, 2021, and the dates go on, and I have a list of them, where there was a lot of misinformation predating
Tell me a piece of information that I ever promoted about vaccines. Tell me one piece of information.
Mr. Secretary, again, if I could continue.
Well, tell me one piece of misinformation. You said I've promoted misinformation.
Thank you, Mr. Secretary. I'll get there. So, Mr. Secretary, the history shows that you were pushing vaccine misinformation predating your tenure.
Tell me one instance.
Secretary,
Tell me one statement
I just shared with Mr. Secretary.
One statement.
So now, during your leadership at HHS, measles, a disease once eliminated in the United States, is on the rise in over 1,700 Americans, as you're aware. You've been asked by colleagues as well where, kids died last year as a result.
Can I answer the question?
Vaccine. I don't have a question yet, Mr. Secretary.
You're making misstatements.
At a previous hearing, you seemed to almost brag about how well the United States has fared in response to measles outbreaks compared to Mexico and Canada. I think here again today.
And Europe and all the other countries.
The United States has always been a leader, and we demand that it's a leader. That should not be a question.
We're still the leader.
Can you please tell us here today what you're going to do to reduce the number of measles cases and improve the MMR vaccination rate?
Improve the MMR. We promote the MMR. We advise every child to get the MMR. That's what we do.
Mr. Secretary, I'd be happy to just ask for that to be in the record, and I'd be happy to get a question in the record. You can respond to it.
Yeah.
I'm real curious if you're going to include funding a coordinated vaccine education and distribution campaign, for example, countering misinformation about measles and the MMR vaccine.
Tell me one piece of misinformation I've ever said. One statement, just one.
If I could continue, Mr. Secretary.
You say you have a list of them. Read one.
Tailoring outreach to communities with declining vaccination rates as well, measuring whether those campaigns are working.
You're just making things up, Senator. You're just inventing stuff. Tell me one piece of it. You say you have a whole list there. Read me one thing I've ever said.
Mr. Secretary, if you want to run for the United States Senate and get on the dais here, you're happy to do it. You should resign from the HHS today and run for office. And you can be in here, you can ask anyone all the questions you want, Mr. Secretary. I'm asking you some questions. What I just gave you wasn't even—
You're not asking questions. You're just making statements that are incorrect.
Let me ask you a question about someone that you know very well, David Geyer. So, Mr. Secretary, does David Geyer work for you?
He is a contract.
So, Mr. Secretary, last time you were here, I asked you, why was it that David Geyer was listed on the HHS director as a senior data analyst? He still is. Is he a contract member or is he a contractor?
He's a contract employee.
Mr. Secretary, you were asked by one of my colleagues about getting their hands on some documents that you may have. Do you have Mr. Geyer's contract?
I imagine we do.
Would you share that with the committee by Friday?
I don't think there's any legal problem with it. If I have
It's not
to
a
check
legal
with the
problem.
lawyer.
It's subject to Information and Public Records Act, which we could go about
Well,
as
then,
well.
yeah, I'm happy to.
I appreciate that.
If
And including in the contract, would you share, can we expect you to share with the committee by Friday the scope of David Geyer's contract?
I don't see any reason why not.
I appreciate that. Does David Geyer report to the HHS office here in DC?
He reports to the CDC.
So what I asked for in the last time we had a conversation, Mr. Secretary, was about the protocols that go into David Geyer's work. You responded to me by saying that those protocols are public. They are not. I asked the committee chair.
I said
and
they
ranking
will be
member,
public when he does the work, when he develops the protocols.
will you commit to share the protocols to David Geyer's work with this committee by Friday?
No, I won't, because they
So-
don't exist.
Okay, so Mr. Secretary, I appreciate that honest response. Mr. Chairman, Ranking Member Wyden, you'll remember, and I can get you the information from this. Last time I asked this question to the Secretary, he said it was all public, it was all available. He just said it's not. So I don't know if it's going to take us
I
to
said it's
subpoena or
going,
IPRA,
I said
but
we will make it available when it's done.
I certainly hope that we can get our hands on the protocol information and David Geyer's work. Thank you, Mr. Chairman.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.